If you're in your 60s, 70s, or 80s, pay close attention. There's a silent problem in your mouth that could be increasing your risk of a heart attack. And most people have no idea. You might brush your teeth every day, use mouthwash, and think everything is fine. But if you ignore this issue, you could be putting your life in danger. And here's the scariest part. It could be happening right now without causing any pain. That means that by the time symptoms appear, it might already be too late. But don't worry. Today, I'm going to show you the 3 most dangerous signs that your mouth is sending a red alert to your heart. And more importantly, what you can do to prevent this from turning into a life-threatening problem. Make sure to stay until the end, because the 3rd symptom is one of the most overlooked, but it could be the most dangerous of all. Now, tell me, have you ever noticed any issues with your teeth or gums? Drop a comment below. And if you want to keep getting valuable health and longevity tips, hit that subscribe button and turn on notifications. First sign, bleeding gums. The first warning that something is wrong. If you notice a bit of bleeding when brushing or flossing, don't ignore it. Many people over 60 think it's normal or just a part of aging, but that's a big mistake. Healthy gums don't bleed. If you see blood when brushing or flossing, your body is sending you a red alert. This could be one of the first signs of gingivitis, an early stage of gum inflammation caused by plaque buildup. At first, it may seem harmless, with no pain or major discomfort. But if left untreated, it can develop into something far more serious. Periodontitis, a severe infection that destroys the tissues supporting your teeth, leading to bone loss and even tooth loss. Now, here's the biggest danger. The problem isn't just in your mouth. The bacteria responsible for this inflammation can enter your bloodstream, travel through your body, and cause inflammation in your blood vessels, increasing the risk of heart attacks, strokes, and even respiratory issues. These bacteria release toxins that promote plaque buildup in your arteries, a process called atherosclerosis, which can lead to a heart attack. But why is this issue so common in people over 60? As we age, our bodies go through natural changes that make us more vulnerable to gum disease. Reduce saliva production. Saliva plays a crucial role in cleaning the mouth and controlling bacteria. As we age, saliva production decreases, making the mouth more prone to infections. Medication side effects. Many common medications for high blood pressure, diabetes, and other age-related conditions cause dry mouth, leading to increased bacterial growth. Difficulty maintaining oral hygiene. If you wear dentures or struggle to brush properly, food particles and plaque can easily build up. How do you know if your bleeding gums are a serious problem? Besides bleeding, watch out for these warning signs. Red, swollen gum sensitivity when touching or eating, persistent bad breath, even after brushing, receding gums, making your teeth look longer. If you notice 2 or more of these symptoms, it's time to take action immediately. How to treat and prevent bleeding gums to protect your heart. The good news is that if caught early, bleeding gums can be reversed before causing permanent damage. Here are the essential steps to restore your gum health and protect your heart. 1. Brush properly, but don't overdo it. Many people think brushing harder will clean their teeth better, but that only makes things worse. Use a soft bristled toothbrush and gentle circular motions to clean thoroughly without damaging your gums. 2. Floss every day, no excuses. If your gums bleed when flossing, it means you need it even more. The plaque buildup between your teeth is already causing inflammation. Over time, consistent flossing will stop the bleeding and improve gum health. 3. Stay hydrated and boost saliva production. Drinking water throughout the day helps keep your mouth moist and washes away food particles. Chewing fibrous foods like apples and raw carrots can also stimulate saliva production, which naturally fights bacteria. 4. Choose the right mouthwash. Many commercial mouthwashes contain alcohol, which dries out your mouth and worsens inflammation. Instead, opt for chlorhexidine-based or natural mouthwashes with tea tree oil, which help reduce bacteria without harming moisture levels. 5. Eat a diet rich in essential nutrients. Vitamin C strengthens gums and fights infections. Found in oranges, kiwis, bell peppers, and strawberries. Omega-3 reduces inflammation in the body and gums. found in salmon and sardines, the calcium and vitamin D, essential for bone health, preventing loss of the jawbone that supports your teeth. Get it from dairy products, yogurt, and moderate sun exposure. 6. Visit your dentist regularly even if you don't feel pain. Seeing a dentist at least twice a year is crucial. A professional can detect early signs of gingivitis and periodontitis before they become serious. If needed, they can perform a deep cleaning to remove tartar and prevent the infection from spreading. If you're a senior, bleeding gums are not just a normal part of aging. They're a warning sign that something is wrong. Ignoring this issue could put your life at risk. Second sign, persistent bad breath. If you're in your 60s, 70s, or 80s and notice that your breath doesn't improve even after brushing your teeth, it could be a sign of something much more serious than just a social inconvenience. Chronic bad breath, also known as halitosis, could indicate a silent infection in your mouth, one that can impact your overall health, including your heart. Many people assume bad breath is only caused by food, like eating garlic or onions. But if the problem persists even after brushing and using mouthwash, it might be a hidden sign of periodontitis, a severe gum infection that destroys the bone supporting your teeth and releases bacteria into your bloodstream. And here's the real danger. These bacteria can inflame blood vessels and increase your risk of a heart attack. Studies show that people with severe periodontitis have a much higher risk of developing cardiovascular diseases, including high blood pressure, heart attacks, and strokes. Now, let's break down exactly how this problem starts and how you can stop it before it's too late. Why does bad breath become more common after 60? Aging itself doesn't cause bad breath, but certain natural changes in the body can make you more vulnerable. Dry mouth, xerostomia. As you age, saliva production naturally decreases, and that's a big problem. Saliva plays a key role in cleaning the mouth, washing away bacteria and food particles. When there isn't enough saliva, bacteria multiply quickly, releasing foul-smelling compounds like volatile sulfur compounds, VSCs, which cause bad breath. Medication side effects. Many medications commonly used by older adults, such as those for high blood pressure, diabetes, and depression, can reduce saliva production, increasing mouth dryness and making bad breath worse. Digestive issues. Acid reflux, which becomes more common with age, can cause stomach acids to travel up the throat, leading to a persistent sour-smelling breath. Poorly fitted dentures. If dentures or dental prosthetics aren't cleaned properly, they can trap food particles and bacteria, creating a constant bad smell. Gum infections, periodontitis. If bad breath persists even with good oral hygiene, bacteria may be trapped inside deep gum pockets, releasing toxins that inflame the gums and increase cardiovascular risks. Now that you know what might be causing the problem, let's talk about how to fix it for good. How to get rid of bad breath and protect your heart. If you're 60, 70, or 80 plus and struggling with persistent bad breath, don't accept it as a normal part of aging. Here are the most effective solutions to restore your oral health and prevent heart problems. 1. Boost saliva production. If your mouth is constantly dry, you need to increase saliva flow to stop bacteria from multiplying. Here's how. Drink plenty of water throughout the day to stay hydrated. Chew raw, crunchy foods like apples, cucumbers, and carrots to naturally stimulate saliva production. Chew sugar-free gum to activate your salivary glands. 2. Complete oral hygiene. Brushing alone isn't enough. Many people think brushing their teeth is enough, but that's far from the truth. Bad breath often comes from the tongue and gums, so you need more than just brushing. Use a tongue scraper. About 80% of bad breath bacteria live on your tongue. Scraping or brushing your tongue daily removes the white coating that builds up at the back of your mouth. Floss every day. If you don't floss, food particles get trapped between your teeth, fermenting and creating foul odors. Use an alcohol-free mouthwash. Alcohol dries out your mouth, making bad breath worse. Instead, choose a chlorhexidine-based mouthwash or a natural formula with tea tree oil. 3. Take care of your dentures and dental prosthetics. If you wear dentures or any type of dental prosthesis, proper cleaning is essential. Otherwise, bacteria, and food debris can cause bad breath and inflammation. Clean your dentures daily with mild soap and a soft brush. Soak them overnight in an antiseptic solution designed for dentures. Avoid sleeping with your dentures on, as it creates the perfect environment for bacterial growth. 4. Avoid foods that make bad breath worse. Some foods can worsen the problem, so try to limit your intake of excessive coffee. It dries out your mouth. Alcohol dehydrates and promotes bacterial overgrowth. Sugary foods, they feed the bacteria responsible for bad breath. On the other hand, fiber-rich foods and probiotics help maintain a healthy mouth and balanced digestion. Plain, unsweetened yogurt can help reduce odor-causing bacteria. Green tea contains natural antibacterial compounds that fight bad breath. 5. See a dentist. If you've tried these solutions and your bad breath won't go away, it's essential to visit a dentist for a full evaluation. If the cause is periodontitis, you may need a professional deep cleaning to remove the infection and prevent bone loss. If the issue is dry mouth from medication, your dentist might recommend a different medication or a saliva-boosting gel. If digestive problems are the cause, a doctor can check for acid reflux or other underlying conditions. If you're over 60, persistent bad breath is not just a normal part of aging. It could be a sign of a much more serious issue, including gum infections that can affect your heart. Now tell me, have you ever struggled with bad breath that wouldn't go away? What do you try to fix it? Drop a comment below and stay tuned. The next symptom is even more alarming, and many people don't notice it until it's too late. Third sign, loose or shifting teeth. The most dangerous warning for people in their 60s, 70s, and 80s. If you've noticed that your teeth are shifting, becoming misaligned, or even feeling loose, this could be one of the most serious signs that your oral health is at risk. And it might even be affecting your heart. Many people over 60 believe that losing teeth is just a natural part of aging. But that's a dangerous misconception. If your teeth are starting to move, it means something is happening to the bone that supports them. And this issue can have serious consequences beyond your mouth. The truth is, healthy teeth should not move throughout your lifetime. If this is happening to you, there's a high chance you have advanced periodontitis, a severe gum infection that destroys the jawbone and allows dangerous bacteria to enter your bloodstream, increasing your risk of heart attacks, strokes, and serious cardiovascular diseases. Let's break down why this happens and what you need to do right now to prevent tooth loss and protect your health. Why do teeth start to loosen after 60? Your teeth stay firmly in place thanks to a strong bone structure called the alveolar bone and a tissue called the periodontal ligament. Together, these form the foundation that keeps your teeth anchored in your gums. However, as you age, this foundation can weaken due to several factors. Advanced gum disease, periodontitis. This is the leading cause of loose or shifting teeth in older adults. Periodontitis occurs when a gum infection gradually destroys the alveolar bone, leaving teeth with less support and increasing the risk of tooth loss. Natural bone loss. Over time, bone mass decreases, especially if you don't get enough calcium and vitamin D. This affects not only your body's bones, but also your jawbone, making your teeth more vulnerable. Poorly fitted dentures. If you've worn dentures or bridges for years without proper adjustments, your jawbone may be shrinking faster than normal, contributing to loose teeth. Teeth grinding and excessive bite force. Many people clench or grind their teeth without realizing it, especially during sleep. This habit can accelerate bone loss and lead to tooth movement or misalignment. Uncontrolled diabetes. High blood sugar levels increase inflammation in the body, which can speed up bone destruction around the teeth. If your teeth are shifting or loosening, you need to act fast. Ignoring the issue can lead to rapid tooth loss, affecting not just your ability to chew, but also your overall health. How loose teeth are connected to heart attack risk. You might be wondering, what does this have to do with the heart? The answer lies in chronic inflammation caused by periodontitis. When there's an active infection in your gums, bacteria can enter your bloodstream and travel throughout your body. This triggers inflammation in your blood vessels, leading to the formation of fatty plaques in your arteries, which dramatically increases the risk of a heart attack or stroke. Research shows that people with severe periodontitis are 49% more likely to develop heart disease than those with healthy gums. In other words, this is not just a dental problem. It's a life-threatening health risk. Now that you understand the danger, let's talk about how to stop your teeth from getting looser and strengthen your oral health. How to prevent tooth loss and protect your heart. If you've noticed that your teeth feel looser or are shifting, follow these steps immediately. 1. See a periodontist, gum disease specialist. Your first step should be to schedule an appointment with a periodontist, a dentist who specializes in gum disease treatment. They can check for bone loss around your teeth and recommend the best treatment before the problem gets worse. If bone loss is detected early, it may be reversible with deep cleaning and proper care. However, if periodontitis is advanced, you may need more intensive treatment to save your teeth. 2. Strengthen your diet with calcium and vitamin D. The bone that supports your teeth needs calcium and vitamin D to stay strong. If your diet lacks these nutrients, your jawbone can weaken, causing teeth to become loose. Best sources of calcium: milk, cheese, yogurt, almonds, and dark leafy greens. Best sources of vitamin D: eggs, fatty fish, salmon, sardines, and at least 15 minutes of sun exposure per day. If necessary, a doctor may recommend a supplement to strengthen your jawbone. 3. Avoid alcohol-based mouthwashes. Some mouthwashes contain alcohol, which dries out your mouth and can worsen gum inflammation. Instead, choose natural options like chlorhexidine-based mouthwash or tea tree oil mouthwash, which kill bacteria without reducing moisture in your mouth. 4. Quit smoking if you smoke. Smoking reduces blood flow to the gums, accelerates bone destruction, and slows down healing. If you smoke, quitting is crucial to prevent tooth loss and protect your heart health. 5. Improve your oral hygiene routine. Use a soft bristled toothbrush and gentle circular motions to avoid further gum damage. Floss daily. Even if your gums bleed, it means they need cleaning. Use a tongue scraper to remove bacteria that build up at the back of your mouth. Now tell me, have you noticed that your teeth feel looser than before? If so, drop a comment below. Taking care of your oral health isn't just about aesthetics. It's a matter of life and death. If you've noticed any of these symptoms, don't ignore them. The sooner you take action, the better your chances of avoiding serious health issues in the future. Now tell me, have you ever had issues with your gums or loose teeth? Share your experience in the comments below. And if you found this information helpful, just wait until you see what I have for you in the next video. Subscribe to the channel, turn on notifications, and stay tuned for more essential health tips.